Hi, I'm Dan Pleward. I'm the CEO and co-founder of Intely. I want to tell you a little bit today about why we exist. Currently, the healthcare industry and market experiences information sharing obstacles that prevent full interoperability. We're a healthcare data and workflow platform to integrate your data, automate workflows, and connect various applications and solutions across the healthcare ecosystem. Healthcare interoperability is when data can be shared freely in real time and in a structured and standardized format across the industry. It means that anybody who needs the data and is entitled to the data can get the data without delay, easily, and without an undue burden. Healthcare interoperability is difficult for a number of reasons. The first being that technology in healthcare is far behind where it is in other industries. This creates poor infrastructure, lack of standardization. The second is because of privacy and regulations. Data is very protected and siloed in healthcare for good reason. But opening that up to other vendors, other stakeholders, the patients and providers who need that data is still not there. There are many different products that need to integrate with healthcare and healthcare data. Previously, it had just been the electronic medical record system and vendors that were directly related to the organization or healthcare provider. Recently, over the past few years, we've seen a large expansion in digital health products, consumer health, and other technology vendors that want to integrate and get into the healthcare vertical. While I think this is important, they definitely need access to healthcare data that powers their applications and delivers on their value proposition to care delivery. Interoperability is all about improving patient outcomes and care delivery. Interoperability gets the right data to the right people in real time as they're making decisions about patient care and many other things. If we can unlock interoperability for healthcare between organizations and between stakeholders, this serves to improve the value that providers and organizations and other products can bring to patients as they are providing care. We developed a no-code form builder that's fully integrated, flexible, and automated for healthcare workflows. We believe that this will handle the complexity and the heavy lifting around data capture and data collection for patients, providers, and other stakeholders throughout healthcare workflows. EMRs certainly don't make it easy to integrate data and integrate with their system. I've yet to come across two EMRs that have the same integration specs. That being said, it generally can be done. It's just complex, it's burdensome, and a lot of the times takes a lot of effort, and it requires getting connected to the right people within the healthcare organization or at the EMR company to do so. At Intely, we want to take that off your plate. We'll handle the heavy lifting and complexity around interoperability so you can connect to all the healthcare data you need, get the data when you need it, where you need it, and power your application or your delivery of care. Fire, the new implementation of HL7, is very innovative. It leverages API technology over the traditional HL7 messaging channels. Unfortunately, we've yet to see Fire really take hold of the healthcare interoperability market and establish itself as the leading standard for transferring and sharing healthcare data. There's probably many reasons for that, one of which being that there's poor implementation across the board of Fire. There's very few regulations that explicitly state how Fire should be implemented, what resources should be implemented, and how that's made available to outside stakeholders. Additionally, it's easy to get data. Fire is query-based by nature, but there is no event-based architecture that goes along with Fire. It'd be nice to subscribe to a resource and receive the data in real time as the event's occurring, similarly to how HL7 v2 channels and integration are set up. When deciding upon how to integrate healthcare data into your workflow, application, or solution, It's important to evaluate whether you want to build a solution in-house or partner with an integration vendor to set up the EMR and healthcare data integration for your solution or application. When you're making this decision, it's important to think about access and scope. If you need to integrate with many disparate systems for a set workflow, it's likely beneficial to partner with a company, as they can make that a repeatable process and handle the various connection points across organizations and different vendors. To successfully integrate healthcare data and unlock interoperability, if you want to do that natively, it's going to require creating an entirely separate product within your application to serve as the connection middleware between you and the healthcare organization. At Intely, we find that there's a value in providing the infrastructure that other applications, solutions, and stakeholders need to connect their healthcare data to the workflows to drive adoption and implementation.